Bereavement disorder, also known as prolonged grief disorder, is a condition in which a person experiences a prolonged and intense form of grief following the death of a loved one. It is estimated that up to 10% of people who experience the death of a loved one may develop this disorder. In this presentation, we will explore what bereavement disorder is, its causes, diagnosis, and treatment options. Bereavement disorder is characterized by symptoms such as intense feelings of sadness, loneliness, and yearning for the deceased, along with difficulty accepting the reality of their death. People with bereavement disorder may also experience feelings of guilt, anger, and bitterness towards themselves or others, and may withdraw from social activities, experience difficulty sleeping or concentrating, and lose interest in previously enjoyable activities. These symptoms persist for an extended period of time, generally 6 months or longer, and can significantly impact a person's ability to function in daily life. Grief, on the other hand, refers to the emotional response to the loss. It is the feeling of sadness, pain, and other emotions that arise in response to bereavement. Grief is the natural response to loss, and it can take many forms, including anger, guilt, and depression. Grief is a normal and necessary process that allows a person to work through their emotions and come to terms with the loss. The causes of bereavement disorder are complex and multifaceted. A significant factor in the development of this disorder is the nature of the relationship with the deceased. A person who had a close, dependent, or conflicted relationship with the deceased is at a higher risk of developing this disorder. Other factors that contribute to the development of bereavement disorder include a lack of social support, a history of anxiety or depression, and the circumstances surrounding the death, such as a sudden or traumatic loss. Diagnosis of bereavement disorder is made when the symptoms have persisted for a minimum of 6 months and are causing significant impairment in daily life. A trained mental health professional, such as a psychologist or psychiatrist, can conduct a thorough assessment to rule out other potential causes of the symptoms, such as major depressive disorder or post-traumatic stress disorder. Treatment options for bereavement disorder can include psychotherapy, medication, and support groups. Psychotherapy can help individuals learn coping strategies and work through the grief process in a healthy way. Cognitive behavioral therapy, in particular, has been shown to be effective in treating bereavement disorder. Medications such as antidepressants may be prescribed in some cases to alleviate symptoms of depression or anxiety. Support groups can provide a safe space for individuals to connect with others who are going through similar experiences and receive emotional support and guidance. Bereavement disorder is a complex condition that can significantly impact a person's ability to function in daily life. It is caused by a variety of factors, including the nature of the relationship with the deceased, lack of social support, and circumstances surrounding the death. Diagnosis of this disorder is made when symptoms persist for at least 6 months and cause significant impairment in daily life. Treatment options can include psychotherapy, medication, and support groups, and it is important for individuals experiencing symptoms of prolonged grief to seek professional help to manage their condition.